Introduction to Pharmacoepidemiology. Learning objective. Learn the basic definition of pharmacoepidemiology. What is pharmacoepidemiology? We will go over some definitions of pharmacoepidemiology. We start with the most famous or the godfather of pharmacoepidemiology, Strom. He defines pharmacoepidemiology as the study of the use and effects of medications in large numbers of people. Another definition includes the application of epidemiological knowledge, methods, and reasoning to the study of the effect, beneficial and adverse, and use of drugs in human populations. Also, we can define pharmacoepidemiology as the study of drugs and determinants of health and disease in the general unselected population. So we have pharmacoepidemiology here interacts with two major fields of science: epidemiology, which is concerned of the disease, and the clinical pharmacology, which is concerned about the drugs. So pharmacoepidemiology interacts with four major types of sciences: pharmacology, therapeutics, epidemiology, and statistics. So it's an interaction between epidemiology, clinical epidemiology, outcome research, health economics, and health services research. All of them interact with clinical and pharmacoepidemiology. Pharmacology in general is concerned with the effect of the drug, while clinical pharmacology is concerned with the effect of the drug in human, clinical effects. That's why pharmacoepidemiology interacts with clinical pharmacology rather than pure pharmacology. So basically, pharmacoepidemiology studies the use of and the effect of drugs in large number of people. The pharmacoepidemiology field uses the techniques of chronic disease in epidemiology to study the use and the effect of drugs in larger populations. Historical background. How pharmacoepidemiology was developed. Let's go back to 1906 when Pure Food and Drug Act was developed, that was later formed to FD, Food and Drug Administration, in 1938. Then, preclinical toxicity testing and clinical data about drug safety were required before drug marketing. In 1961, a major thing happened. A paper was published in Lancet Journal linking the use of thalidomide drug with congenital anomalies in babies. That was called thalidomide disaster. After this paper was published and the link was obtained, that led to establishment of Committee of Safety in Medication in 1968 in the UK. That changed everything related about drug manufacturing. Pharmacoepidemiology first appeared in a medical literature in a journal in 1984 in a paper published in the British Medical Journal. This is the thalidomide and congenital abnormalities study that changed all the regulations related to the safety measures and studies related to drug approval process. What papers in general have shaped pharmacoepidemiology? This famous paper that was published in the New England Journal of Medicine studied the effect of maternal exposure to stilbestrol therapy with tumor appearance in young women. This was a pharmacoepidemiology design. It linked exposure, which is the drug. So in pharmacoepidemiology, our concern is about the drug. The exposure in pharmacoepidemiology is drug exposure and its association with an outcome, which appeared to be in this study a tumor. Another famous paper that was published in Lancet Medical Journal in 1989 linked the psychotropic drug use and the risk of hip fractures. Famous study that discussed the effect of hip fractures in patients taking psychotropic therapy. So as you can see, in pharmacoepidemiology, we go on more focus of linking drug use with outcomes whether it's disease or any outcome of interest. Also, another famous study published in the American Journal of Medicine in 2006, for example, colorectal cancer after start of non-steroidal anti-inflammatory drug use. So, as you can see, all these examples until now have shown a link between drug and outcomes, and these drugs are approved by the FDA. However, in pharmacoepidemiology, we study the effect of these drugs after they are released to the market, post-marketing, after these drugs are used by larger populations of people.